Remember when Joe Biden said this?
The pandemic is over.
You remember that?
In May. You must have cut it before he said May.
This was like a year ago, he said.
Now you're editing select.
The pandemic is over.
So he said that like a year ago, right? Could you check when he was on 60 Minutes? Joe Biden on 60 Minutes.
Got it.
But now, here is this new Frankenstein person from the WHO. And listen to what she has to say.
We want to end this emergency in every country on the planet in 2023, and we can do this.
They want to end the emergency, Kurt, in every country.
Now, I thought Ukraine already did that.
I thought Ukraine ended COVID. I was wrong. Joe Biden said COVID's over. The WHO said it's still an emergency. So this was September. Joe Biden said COVID was over last September.
Oh.
Last September, it was over, but the lady from the WHO gets to supersede him.
Yeah, he doesn't have the authority to say that.
He doesn't. She has the authority. And what does she say? She says, we're in an emergency. Does it feel like you're in an emergency? It doesn't feel like an emergency. I know we're in one because the lady from the WHO said so.
Maybe they need to lock us down so we can feel it.
We want to end this emergency in every country on the planet in 2023, and we can do this. So what we are asking all member states, all countries around the world to do.
You can end COVID or you can end this emergency. Do you see how they mislead you? She's making people think that there's a way to end COVID. That's what she's doing. But she will say, no, I meant we can end the emergency of COVID.
Do you think the camera's going to pull out and she's going to be the one playing piano, dramatic piano?
So what they're doing is they're trying to add soft background music to make the WHO seem trustworthy.
Yeah.
And to make everything seem more serious than it is. And
it's like Justice League music.
So she still wants you, because Big Pharma wants you to think that we can vaccinate our way out of this. That's what they want you to think. And if enough people just got vaccinated, we would end COVID. That's not true.
Look, it's an emergency. We haven't made enough money selling this stuff bulk to governments.
Here we go. She's got a lot more to say.
Good.
Is to reassess their situation. Have a fresh look at what you're doing and look at what needs to be adjusted. So we need to strengthen the systems in countries around surveillance. We need to strengthen.
What?
Yeah, did you hear?
Whoa!
So you have to take a fresh look at how you're handling COVID. A fresh look. What is that? That sounds like George Bush gobbledygook. Could need some fresh eyes. So they haven't been reassessing what they're doing all along? They just set their policy 2 years ago and nobody checked it again? Is that what you're telling me that countries have done? Of course that's not what they've done.
We're going to wait.
But then she takes that and then she slips in surveillance.
Yeah.
Well, around it.
She slips in surveillance. Oh, you care if you really care about people if you're for surveillance. Watch, let me back that up a little bit.
We want to end this emergency in every country on the planet in 2023, and we can do this. So what we are asking all member states, all countries around the world to do is to reassess their situation. Have a fresh look at what you're doing.
Fresh eyes.
And look at what needs to be adjusted. So we need to strengthen the systems in countries around surveillance. We need to strengthen the systems in countries around sequencing. We need to strengthen the clinical care pathway so that any individual, if they are infected with whatever they have, flu, RSV, COVID, they
are immediately surveilled. No matter what it is, if it's a flu or virus, COVID, doesn't matter. They're immediately put in a system and we surveil them. That's what she's saying.
get into that clinical care pathway.
Get it?
They receive.
She calls it a clinical care pathway.
What does that mean?
That means you're going to be surveilled, Kurt. That's what that means.
That antiviral as quickly as possible, so we prevent the hospitalization.
Oh, okay. Wait, that's
but not vitamin D, not vitamin D, not zinc, not
clinical care pathway. What that means is whatever vaccine we just made.
Whatever
they
big.
I thought it meant healthcare maybe.
No,
that's to keep you out of the hospitals. Okay.
Patients need hospitalizations. We need to optimize that care with the right therapy.
They need to optimize their care. If you need to be hospitalized, They need to optimize your care.
They were not doing that now?
They weren't doing that? Exactly. And what is optimizing their care? You want to know what she's going to say? Watch.
Oxygen, ventilation.
Oxygen and ventilation. Nothing. Just like at the beginning of COVID, Big Pharma told the doctors, don't do anything. And all they did was intubate them, put them on thing, and then they died. So they didn't want to find out if any of the drugs treated it. That's why they said, don't do anything. So my doctor actually broke the rules and started prescribing people steroids and other things. And her patients lived. And she got in trouble. They're like, you're not allowed to do this. She did it anyway. She broke rules. And she saved people's lives. And then 6 months later, after it was obvious that a lot of other doctors had broke rules and given people steroids, after it was obvious that the guidance to not give people steroids was garbage and came from pharma, and then they reversed it 6 months later. So my doctor, who was breaking a rule, saving lives, but then her system, her treatment was endorsed by the CDC and the FDA and everybody. So these people are not about saving lives at the WHO. It is billionaire funded, and it is about controlling you. Here we go. There's more.
We save lives. We prioritize.
And that's all she said was oxygen. Could you see that?
Yeah.
Oxygen. That was it.
Can't we get that for free? Or
and focus our vaccination campaigns to ensure that we reach 100% of the at-risk groups.
What?
So notice she said 100% of the at-risk groups with their vaccines. She didn't say 100% of the earth, because they didn't even try to get vaccines to Africa. Most of Africa is not vaccinated.
Right.
And they don't have COVID, and they don't have a big problem with COVID in Africa, and they don't want you to know that. So what she's saying now is that we're going to that people 100% vaccinated at-risk groups, which is what the Great Barrington Declaration said at the beginning of COVID. You should target people. You should target the elderly, the obese, and the diabetic. Those are the people you start to protect. You don't lock down everyone. You don't make a mass emergency youth medical treatment for everybody. That was the Great Barrington Declaration. But they did it anyway, and they treated this pandemic unlike every other pandemic we've had. They never treated them this way until now. And now, I think, is because our government and our media is sufficiently controlled by big pharma and a handful of people like Bill Gates. Bill Gates, the second biggest funder to the WHO. Bill Gates is pulling the strings at the WHO, not a doctor. Not a scientist, not a virologist, but somebody who has a huge financial stake in what the WHO does and mandates. Bill Gates, I'll show you that in a minute. Let's get back to this.
100% of individuals need to be boosted who are over 60, who have underlying conditions, who are immunocompromised.
So they just changed the rules on everything. But they still try to trick you. They go, 100% of people who are over 60 and immunocompromised need to get boosted.
What about children age 19?
Yeah. Right?
And our frontline workers. We use the tools that we can in terms of masking, improving ventilation.
Masking. She's still talking about masking. The WHO is still pushing masking.
If we work, we study. So we need innovation in personal protective equipment to be built and structured for women. Because
women's face bras aren't comfortable enough.
Well, first of all, how do you know they're women? That would be a question for the WHO.
Of healthcare providers are women. We need new and updated vaccines that focus on preventing infection and transmission. We need to understand more about the different types of public health and social measures. And we really need to build trust.
We need to build trust. Why would you need to build trust after a 3-year trust exercise?
We really need to mandate trust.
You should mandate it. I like what Jeffrey A. Tucker says. It was she who wrote the February 2020 report that celebrated China's lockdowns and recommended them to the world.
Well, thanks for pulling your weight, China.
It was her. By the way, this tweet by the WHO got ratioed immediately. Here's 5 times August. Hi, murderers. Stop murdering people. Thanks so much. Sign the non-murderers. This got 1,200 likes. This got 2,000 likes. A response to that. So did they think having this woman come out and make a real earnest looking furrowed brow and say things that sound nice and then they put music behind it? Did you really think that was going to overdo all the bullshit you've done for the last 3 years to us? You think that was going to make us forget about what you've been doing and how much you've lied for money? You think that we're not going to call you murderers?
Jimmy, I don't believe, by the way, that they even had that many likes, the 1,000 likes.
Right.
Because
who would like that?
Well,
except Stephen Colbert's audience.
Even Stephen Colbert's audience are not going to watch that. That's like made in-house. I'll bet people that work there or something are on the thing and have to like it. Then maybe bot, but still low where it's bot. Because people I know just in general who talk like that, like, just do it so we can get back to normal. They don't even know what the hell the WHO is.
They have no idea.
They would never watch a promo from it. So who would watch this and like it?
I don't know. Well, I could show you who didn't. So this is right underneath their video. Every fucking thing was ripping them and ratioing them. So there's the 5 times August guys. Dr. Simon Godek says, we can also lock you all up and end the global health emergency right away. 3,000 likes.
Yeah.
Libertarian New Hampshire says, go fuck yourselves. 2,000 likes. They're all ratioing the WHO.
So far, people are responding most to locking her up.
Yeah. The WHO has long drifted away from its original purpose to improve health globally. After having been taken over by private contributors, which I'm going to show you in a second, after having been taken over by private contributors, their goal is, of course, to improve the wealth of their contributors in the name of saving humanity. Disgusting. Still no mention of vitamin D, sunlight, ivermectin, hydroxychloroquine. The WHO is just a sales arm of Big Pharma.
I thought it stood for World Health Owners.
Still no mention of any of those things. Now, of course, the reason why they don't mention ivermectin or hydroxychloroquine is because everyone knows they don't work, no matter what the studies say.
They better not.
No matter what the studies say, no matter what your personal experience is, no matter what the frontline doctors say, ivermectin does not treat COVID. No matter what.
First of all, you shouldn't be reading about it anyway.
You shouldn't even be reading about it. That's called doing your own research, and that's what dumb people do. Who funds the WHO? Top 20 contributors? Number 1 is Germany.
Nice.
Number 2, Bill Gates.
Second only to Germany.
Second only to a country. Second only to one of the most wealthy country in Europe.
751 million. Wow, almost $1 billion, huh?
So Bill Gates gives them $750 million, and then he gets to pull the strings at the WHO.
Well, also Germany does.
He gives more money to the WHO than the United States of America. Then next is the UK. Then next is the European Commission. Then the Gavi Alliance. What?
What's that?
Some private group. Go look up Gavi Alliance. Then the country of Japan, the country of Canada, then the Rotary International.
What's that, the Rotary Club?
That's that the Rotary Club? That's fucking businessmen.
Oh, that's what Rotary is.
Hey, Siri, what is Rotary International? Rotary International is one of the largest service organizations in the world. Its stated mission is to provide service to others, promote integrity, and advance world understanding, goodwill, and peace through fellowship of business.
Oh my God.
Fellowship of business. It's a fellowship of business. It's a Rotary Club.
Oh, business ship.
Business ship. So that's what it sounds like to me.
Do you want to know Gavi Alliance?
Yeah, Gavi Alliance.
Gavi Alliance, about our alliance. As part of its mission to save lives and protect people's health by increasing equitable and sustainable use of vaccines. Gavi has helped vaccinate more than 980 million children in the world's poorest
Bill Gates?
countries, preventing more than 16.2 million future deaths.
What's it stand for?
Gavi? Oh, I don't know, but if you look right underneath, the Rotary is the COVID-19 Solidarity Response Fund. Are you shitting me?
What the hell is that? I mean, is it going to have... will it have equity and sustainable in its mission statement?
I hope it cares about saving lives through vaccines.
We need a susceptible and equitable health for all.
Hey Siri, who is the COVID-19 Solidarity Response Fund? Oh, no. It just says, just the World Health Organization comes up.
The Global Alliance for Vaccines and Immunizations is Gavi.
Oh, okay. That's the Global Alliance. I'm sure there's not a lot of money involved in any of that. I'm sure they're not a front for a vaccine company. I'm sure they're not. I'm sure they're not a front for somebody trying to sell shit.
Can I read one more thing to you about the Gavi Alliance?
Please do.
It says Gavi also works with donors, including sovereign governments, private sector foundations, and corporate partners.
Oh, really?
NGOs, advocacy groups, professional and community associations, faith-based organizations, academia, vaccine manufacturers, including those in emerging markets, research and technical health institutes, and implementing country governments. I don't understand that last part. Implementing country governments?
Me neither. I don't get it.
Wait, okay. Advanced Market Commitments, AMCs, aim to overcome market failure by making an advance pledge that if a vaccine for a certain condition is developed, meeting certain specifications, donors will buy a certain number of doses. Gavi seeks to design its AMCs in a way that encourages competitive market. So that's why they couldn't open source the how to make it. Remember they wow.
And so these people are such liars because they won't give the vaccine to poor countries for free. Bill Gates stopped Oxford from giving out the AstraZeneca vaccine for free. They were going to. He stopped them.
In 2012,
I'm going to guess he made a donation to them to make them stop. Go ahead.
In 2012, the first Medicines Sans Frontieres, The Right Shot report criticized Gavi for focusing on funding expensive new vaccines and neglecting to give children low-cost older ones.
Okay.
20% of the world's children aren't even getting the basic vaccines.
So why is the WHO funded like this? Why do we let vaccine profiteers?
We're great for our pharmaceutical company.
That's right. So now you see who funds fucking WHO. It's a bunch of people who are making money off of vaccines.
Who's supposed to fund it?
Why is that? Well, countries should.
Yeah. So it's exactly like the FDA. They start coming in. Hey, you're making profits. You should donate.
Yes.
It's only fair.
It's only fair.
Yeah.
That's how they
and then they own it.
So the same thing happened in the UK. So like we have the FDA and the CDC here. So the big pharma just corrupt. They pay for 70% of the vaccine research and stuff, the drug research, all the approvals. The big pharma funds it, and then the people who approve it go get a job at pharma right after they approve it.
And then they make sure the old vaccine. So they're anti.
Old vax. Yeah.
I like the newest of the new.
I like the experiment.
You want those old tested ones that we have data about?
Are you still fighting chicken pox the old-fashioned way? Are you still fighting measles the old-fashioned way?
Oh, my God.
So this guy says, translation, welcome to the global biomedical surveillance state. AKA medical tyranny.
Well, it works for the security state.
It works. I can never. So this is what they've done. This is what the global health organizations have done during COVID. They've left people feeling like this. I can never trust the WHO ever again. I can't trust the pharmaceutical industry either. Same with doctors. Same with scientists.
Wow. Can you imagine if big oil and big coal ran the green climate change initiatives for everything? How bad that would be?
This is my favorite. On et côté and vomit means we listen, we vomit. So the WHO now gets this woman who they think is going to be attractive and people will like her and she's going to be sympathetic because she's a woman, and it's not working.
Well, they should have got that fat idiot with the bow tie, Hortez.
Yes.
He's a plucky spirit.
So someone who looks like that can still be evil and doing the bidding of billionaire class for profit over your health. That's what she, so if
looks like a lot of them.
Yeah. So that's it. Just because she's a woman, And then she really raises her eyebrows, though. Like, look at that. She's like, we can do this. Oh, fuck off. We can do. That makes them sound like such do-gooders.
You better not be allowed to.
Well, I want to end COVID. Let's do it. They want to do it. We can do it.
Oh, my God.
All right, over to Steph.
All right, and they all want you to know that Gavi is funded by Gates.
I was right.
You're 100% right.
Oh, my God.
Hey, everybody, we're doing live stand-up comedy. We're going to Tempe, Palm Springs, Milwaukee, Nashville, Northampton, Massachusetts, Syracuse, New York, Cohost, New York, Hartford, Connecticut, and Washington, D.C. Go to jimmydore.com for a link for all those tickets.